Now, the flip side to enhanced access to that sort of thing, using the internet and online resources, do you find that there's also a lot of misinformation about oxygen therapy online?
There are some myths. I think when I speak to patients, I always bring these up. So there are some, I guess you call it misinformation or misunderstanding about oxygen. And the first I think I hear most often is it's addictive. If I start using it, I'm going to need more. So I'll put it off because I don't want to get addicted to oxygen. And, the good news is oxygen is not addicting. Your body only takes what it needs. And your needs don't increase over time unless your lung disease progresses over time. And that does happen with many patients. So in and of itself, oxygen use does not make you addicted to it. Your body only needs what it physiologically, is missing. So it's not like a narcotic where you actually gain resistance to it over time. It's not the same. So that's one myth. I think about the risks of oxygen therapy around fire. I think some patients think that their oxygen canister is going to spontaneously explode. It won't. The exposure has to be that oxygen flowing and being exposed to a flame. So that could be in the form of a cigarette, which we of course hope is not going on, or an open gas stove. Those are the two most common things I think about. So it is flammable, but it doesn't just explode. I think those are the most common that I hear about. If there's others, you could ask me about that, but I don't think, and I think one area is the online marketing. I think patients can be misinformed shopping for oxygen and finding devices that they think, oh, this is great, it's small, it's portable, even from reputable manufacturers, which is important to identify. But it's very important to talk to your clinician about an oxygen piece of equipment that you think is great for you because of the marketing, and make sure that the flow rate matches your needs. So that's a bit of misinformation, that some of these nice tiny devices are great for everybody. That's not true. You have to really know your own needs and work with your clinicians.
I think it's also important to find out that not only are there those devices out there, but there are some that aren't even approved by safety organizations like the Food and Drug Administration, and yet are still being sold as this great solution for people. So buyer beware indeed.
Yes, important.